Hello everyone, let's discuss a little about liposuction today. What is liposuction? Very simply put, liposuction is suction of fat. What we do is put in a small tube under the skin and suck out the fat that is collected underneath. Who is an ideal candidate for liposuction? If you are not heavily obese, you lead an active lifestyle, you are otherwise hale and hearty, you have a good BMI, that is a good weight to height ratio, well, you are an ideal candidate for liposuction. The reason I say this is because liposuction is not a weight loss procedure. It is a procedure which helps to reduce the stubborn fat that collects in areas like the love handles or thighs or belly, which does not respond to diet and exercise. And what I would say is that definitely this procedure not only helps in improving the body image, but it also motivates the person to continue his or her fitness goals once they see their well-toned and well-contoured body. Now there are different types of liposuction. We have manual, power assist, ultrasonic assist. These are all various types, but the end result is to be able to suck out fat. What we use in our department at Seven Hills is the latest technology of power assist liposuction. How this helps is it allows us to suck out large amounts of fat in a short period of time. So this reduces the operative time and it also helps in early recovery, early post-op mobilization of the patient. The surgery is performed under anesthesia, so surgery per se is painless. There may be slight pain post-operatively depending on the areas that are liposuctioned and the amount of fat that is suctioned, but this is well controlled and easily controlled with painkillers. Now, where and who should do this kind of surgery? This is a surgery, so definitely it goes without saying it should be done in a well-equipped center. The doctor who performs it should be a well-trained plastic surgeon who is trained in these kind of procedures. So if you do decide to go in for this kind of surgery, do check the credentials of your surgeon. What are the risks or the complications? There are very minor complications like bruising of the skin. There could be swelling. There could be some irregularities of the skin that has been treated. But most of these are easily treatable. The bruises usually disappear within 10 to 15 days. And the swelling of the body also settles with adequate fluids and a restriction of salt intake. One important thing that helps in post-op recovery is compression garments. So your doctor is going to advise you to wear compression garments for the next 3 months. This helps in not only reducing the swelling, but also helps in contouring the body and helps in the skin to contract around the area that has been suctioned. Post-operatively, regarding the discharge, if you have undergone surgery for a few areas, then you may be discharged on the same day. If you have undergone a large volume liposuction or multiple areas have been suctioned at the same time, you may need to stay in hospital for a day or two to assess your parameters and to help you recover faster. Very few patients actually need to stay in hospital for more than 2 days. And the downtime, I would say, is a maximum of 7 days. You can get back to your daily routine within a week. It will be even earlier if it's a very small area that has been suctioned. There are many common questions that we get asked. Number one, whether the fat that has been suctioned out, whether it will come back again. Well, when we do liposuction, we remove the fat cells that are present under the skin, and this is a permanent removal of cells because the cells are, the number of cells is constant. However, the fat cells that remain behind may increase in size in case you do not adhere to the diet and the lifestyle changes that have been explained to you. And there may be a slight increase in the areas that have not been liposuctioned. Another common question that is asked is whether this is going to be a very painful procedure. Well, I have already explained that to you. The pain is there, but it can be easily controlled. The third most common question is how much weight will I lose post procedure? I have already explained that this is not a weight loss procedure. This is primarily a body contouring procedure. So this mainly helps in contouring the areas where the fat has collected and refuses to go away. And definitely, as I said, the benefits of this procedure outweigh the complications and outweigh the risks, because when you get a liposuction done, you see yourself as a better toned, with a better toned body, and that in turn motivates you to pursue your fitness goals and to pursue a healthy lifestyle. So I strongly recommend this procedure in case you're considering it, but it has to be done in a center that is well equipped, that has a good infrastructure, and your surgeon has to be well trained. There are a lot of myths around liposuction. There is a lot of bad propaganda that we keep hearing about this procedure. But if you look at it and if you go back and read the articles in detail, it would have been done in an area which was not equipped, or it was done by a person who was not really qualified to do this procedure. So it is just like any other surgery. It is a safe surgery if done in right hands. Thank you.